Hey guys, so my name is Jasmine Baconleaf and I decided to do our disease video presentation on the herpes simplex virus, also known as HSV. And in this presentation, I will be talking about the cause, symptoms, treatment, prevalence, and prognosis of HSV. So I hope you guys enjoy. So herpes is a sexually transmitted disease, also known as an STD. The cause of herpes or HSV is very simple and can be spread very easily. If a person has an outbreak on their body, then the virus can be spread by touching that part of the body to the moist skin that lines the other person's mouth, anus, and or genitals. HSV can also be spread to other skin surfaces such as the eyes. Although very uncommon, the virus can also be spread even if there is no sign of an outbreak, and overall the disease is spread through skin-to-skin contact. Also, a human cannot get HSV by touching an object that has been previously touched by an infected person. Examples of these objects could be something as simple as a towel or work surface. Some ways of transferring the disease can include having unprotected vaginal or anal sex, having oral sex with a person who gets cold sores, having genital contact with an infected person, and or sharing sex toys. Okay, so next I'm going to talk about the symptoms. The interesting thing actually about herpes is that many people who have the disease sometimes never show symptoms. However, for genital herpes, the symptoms may include things such as painful sores in the genital area, thighs, buttocks, or anus, also painful urination, itching, vaginal discharge, and or lumps in the groin area. Also, during the first outbreak, many people have been known to report flu-like symptoms as well. And then for oral herpes, which is really similar to genital herpes, small blister-like sores may appear. And these sores may show up around the mouth, in the mouth, or on the throat, and in some cases causing the lymph nodes in the neck to swell. And most people commonly know these sores as cold sores. Okay, so now for treatment. Although there is no cure for herpes, medications can help suppress the disease. Medications for herpes can help get rid of an outbreak faster as well as help lessen the pain during an outbreak. Medications can also be taken to help with a primary outbreak as well as recurring outbreaks. So when medicine is taken for recurrent outbreaks, then it should be taken as soon as any feeling or signs of a herpes outbreak appears. However, there is also medication that can be taken daily in order to try and prevent any outbreaks from reoccurring after your first outbreak. Two of the medications that are commonly used for herpes include acyclovir and valacyclovir. So acyclovir can also come in the cream and can be applied during an outbreak on the sores directly as well. So for the prognosis of herpes, after someone is infected by herpes, the reoccurrence and severity actually really vary from person to person. So let me start off by saying again that there's no cure for herpes, but there are medications to help suppress this disease. So many people can actually go years at a time without any signs of the disease. But don't let that fool you. Herpes can still be spread by skin-to-skin contact during this time as well. Times that may cause a herpes outbreak can include, but are not limited to, things such as stress, the common cold, menstruation, and many more. And sores that occur on the mouth are most commonly referred to as cold sores. Mouth herpes is just as contagious as genital herpes when sores are present. Overall, herpes outbreaks may occur more frequently and painful for some people, while others hardly actually have any signs of the disease for years after their diagnosis. So now I'm going to talk about the prevalence for herpes. So herpes is one of the top sexually transmitted diseases out there. According to the CDC, about 1 in 6 Americans aged 14 to 49 is infected with HSV2 or genital herpes. HSV2 was also found to be more prevalent in women at 20.9% than men at 11.5%. The prevalence of herpes is extremely high nationwide. And because it is super high and one of the top sexually transmitted diseases, it is always a good idea to ask and talk to any new sexual partners that you may have about their sexual past and if they have recently been tested for any STDs. Although it is possible for someone to engage in intercourse with herpes without spreading it, it is always a good idea to take extra precautions and to be knowledgeable about the subject just in case. So that is my presentation on the herpes simplex virus, or HSV. I hope you learned a lot, and if you have any questions or comments, make sure to ask me in the comment section. Okay, hope you guys have a good day.